At any given time in the United States, there are a total of 110 sexually transmitted diseases, new or existing, across the nation. According to the CDC, there are 20 million new STDs each year, and half of those are among 18 to 24-year-olds. This age group has a higher risk of acquiring sexually transmitted diseases for a number of reasons, including behavioral issues, biological, and cultural reasons. Some of the barriers to this age group include access to STD prevention and management services, the inability to pay for such services, lack of transportation, long wait times, hours of operation interfering with school and or work hours, and embarrassment or confidentiality concerns. So the purpose of this presentation is to show the importance of sexual education and the influences that sexual education and social media can have on young adults and adolescents' sexual health. Health literacy is basically the degree to which an individual can understand or obtain, process basic health information and services needed to make appropriate health decisions. So young adults are at a higher risk for contracting STDs, and this could be linked to a lack of health literacy on the topic of sexually transmitted diseases. The risk factors for developing STDs include age, race, socioeconomic status, sexual orientation, and barriers to STD prevention, which I mentioned earlier. Many young adults are actually unaware of the fact that STDs can lie dormant in the body for many years or weeks without showing any symptoms, which makes it vital for them to get tested before switching to new partners. In the United States, sexual education widely varies from state to state. This is because there is no required standard for sexual education courses in the United States. In fact, only 22 states require sexual education, and of those 22, only 13 states require that sexual education be medically accurate. That's like saying that a history class is not historically accurate. It just doesn't make any sense. So many school systems that do have sexual education push abstinence-only education, especially true in the Bible Belt, which we're in South Georgia. So this method of education has been proven very ineffective. In fact, nearly half of high school graduates admit to being sexually active before they graduate from high school. Another major cause for this presentation is that many people blame social media and for an increase in negative health effects in young adults. One big firing aspect has been that dating apps have been under fire for a rise in sexually transmitted diseases. So social media has been proven to influence physical and social development in youth, and many apps have began to include disease prevention information to help to decrease the transmission and spread of STDs. Tinder actually integrated a new health safety section in its platform about STDs and STD testing centers. So its users can click on a small pop-up ad on the app, and that will lead them to nearby testing facilities and information regarding the sexually transmitted diseases. This makes for a much safer dating app. By placing these pop-up ads and banners on the apps, the public health community is able to reach many people and a larger audience, especially in the age group of people who are contracting more STDs. As you can see by this chart, the 18 to 29-year-old dominates the social media platforms, and that also correlates with the higher STD rates in the United States at the time, which is the 15 to 24-year-olds. So by placing these pop-up ads and banners, the public health community can work together with social media to decrease the transmission and spread of STDs. When I first started looking into this information, I kind of thought that it would be the opposite. I thought that social media would have a more negative effect on sexual health, and that sexual education would have a more positive effect. But it's only true that sexual education is only going to help with the spread of STDs if it's taught correctly. Abstinence-only programs need to be done away with, and more education needs to be mandated nationwide. Also, social media is really stepping up to begin to help decrease the transmission of sexually transmitted diseases. And I hope that you all have gotten that out of this presentation. Thank you. How long?